According to the Oral Cancer Foundation, over 40,000 Americans will be diagnosed with oral cancer this year, causing roughly 1 death per hour. The 5-year survival rate is only 52%, but when diagnosed early, it can be as high as 80 to 90%. With the recently documented connection of oral cancer to the HPV virus, those numbers are shockingly on the rise, mostly because these cancers are all often caught too late. That's why we've incorporated routine cancer screening into our practice for all patients that are 16 years of age or older. Today I'll be performing a complete oral cancer screening using a variety of dental technologies. First, I'll do a naked eye exam and palpation. Second, I'll conduct a white light portion of the screening using magnification with a portable LED headlight. And finally, I'll be using adjunctive fluorescent technology to identify potential disease areas. We're going to do an enhanced oral assessment for you now. We've gone over your health record, and I'm looking for any abnormalities or areas of concern in your mouth. During the white light exam, I'm looking for any abnormalities in the tissue. While doing the exam, it's important to use a white light for good color rendition. Headlights with higher color temperature will have a more bluish tint, while lights with a lower color will have a more yellow tint. Also, it's critical to have coaxial illumination as close to the line of sight as possible to minimize shadows and glare from the tissue. The light I use is the PeriOptics Mini LED headlight. Despite its small size and light weight, it provides 40,000 lux, which is more than enough light even when using magnification. The color temperature of this light provides an excellent white light for this portion of the exam. For magnification, I use the PeriOptics 2.7 power through the lens loops. I use these for many of my other dental procedures and find they're very comfortable and lightweight even with the attached light. I love that they have very good declination angle and a wide field of view. I'll complete the exam by performing adjunctive fluorescent screening using the Velscope VX. This helps discover oral abnormalities and particularly ones that can lead to cancer. The Velscope allows you to see lesions that won't show up to the naked eye or even under white light examination. I love the VX because it's cordless, compact, and has powerful LEDs to help fluoresce the tissue. I'm doing a comprehensive exam with Velscope fluorescent technology to detect any abnormalities as early as possible. Please put on these glasses.
Is there an additional cost for this exam?
On rare occasions, new patients ask if there's an extra cost for this procedure. To minimize objections and avoid the possibility of a patient refusing this really important treatment, we've incorporated a nominal charge of $7 to $10 into our regular exam fee, which easily pays for the investment and makes our patients happy. No, this is all included as part of your comprehensive examination.
Oh wow, that's great.
It's important to use a new Vel cap and sheath for every patient. The caps ensure asepsis, prevent fogging, and protect the optics, filters, and investment of the unit. Hold the Velscope 3 to 4 inches from the mouth and turn it on by pressing the button with your index finger. When looking through the Velscope, the healthy tissue will have an apple green glow. Abnormal tissue typically appears as an irregular dark area that stands out against the otherwise normal green fluorescent pattern of surrounding healthy tissue. This helps you in differentiating between healthy mucosa and areas of concern that may require further action. The Velscope will also show white, red, viral, fungal, and bacterial lesions that may be underneath the tissue. Velscope training material will help you determine the differences in what you are seeing. Recent studies show that you will see things earlier and better than with the standard visual tactile exam. Document all findings, both normal and abnormal, in the patient's clinical record. This is part of a comprehensive overall oral assessment. These exams are easy for our hygiene staff to do as part of their normal protocol. I know what you're thinking. What if I find something? Well, just remember a few simple things. First, relax. It's important to know that the Velscope is a screening tool, not a diagnostic tool. It helps you see all abnormal lesions, not just cancer. Most detected lesions are not life-threatening, and if you're relaxed, your patient will be too. The second step is to photo document the lesion, include it with the patient's record, and schedule a follow-up appointment within 2 to 3 weeks to rescreen. If the lesion is persistent, gets larger, or changes shape, you'll want to send the patient out for a simple tissue biopsy. Your local oral surgeon or periodontist can do this procedure for you. The Velscope package includes an easy-to-use camera to allow you to have visual record of what you see for your files and for better interdisciplinary communication. It's most likely nothing. I'm going to take a photograph of it and we'll call you back in 2 weeks for a follow-up exam. Again, it's nothing to worry about at all. I just want to be precautious. The beauty of this device is that if it is something, we will catch it early before it has time to spread. And that is how you conduct a complete oral cancer screening examination. This simple to integrate technology helps us ensure the safety of our patients every day that we practice.